Hello, I'm Dr. Hafsa. Today, I will explain the basics of hypertension or raised blood pressure in a way that is easy to understand. Blood pressure is the pressure of the blood pushing against the walls of your arteries. If this is an artery, the blood inside the lumen of the artery or the vessel will exert pressure on the walls of the arteries. I'm marking it with arrows so that it's easier for you to understand the direction, and this is known as the blood pressure. So hypertension is basically the persistent elevation of the blood pressure above 140 over 90. Normal blood pressure is 120 over 80 or less than 120 over 80. So the systolic blood pressure measures the pressure in your arteries when the heart beats or contracts. This right here is the systolic blood pressure, whereas the diastolic blood pressure measures the pressure in your arteries when the heart relaxes. And this right here is the diastolic blood pressure. There's another hypertension known as the white coat hypertension. This generally occurs in hospital or office settings where a doctor wears a white coat, and due to anxiety or stress of being in that hospital setting, the blood pressure is raised. And we can rule this out by an ambulatory blood pressure monitoring that is done at home for 24 hours. Moving on to the etiology or causes of hypertension, it can either be primary, in which there is no identifiable cause, or secondary, in which the renal system, which basically regulates the blood pressure of the body, accounts for 80% of the cases of raised blood pressure. Some cases like glomerulonephritis, adult polycystic kidney disease, and renal artery stenosis can lead to raised blood pressure. Endocrine disorders like Cushing syndrome, Conn syndrome, pheochromocytoma, acromegaly can also contribute to a raised blood pressure. Others like pregnancy, coarctation of aorta, combined oral contraceptive pills, and steroids can also lead to raised blood pressure. We generally classify hypertension into three stages. The first is pre-hypertensive stage, in which the person is not labeled as hypertensive, but he is prone to develop it. The range for systolic blood pressure is 120 to 129, diastolic is below 80 mm of mercury. The stage 1 starts from 130 to 139 mm of mercury, and diastolic blood pressure is 80 to 89 mm of mercury. These two stages are managed by lifestyle modifications, whereas the stage 2, in which the blood pressure is 140 over 90, this stage is managed with pharmacotherapy or medicines. There's another stage, the hypertensive crisis, in which the blood pressure is above 180 over 20, and this can lead to organ damage or failure, which is also known as hypertensive emergency. So how does hypertension occur? Basically, it is an interplay of the genetic and the environmental factors. Whenever there is a defect in the renal sodium hemostasis, there is an inadequate sodium excretion, which means that the sodium is retained inside the body. Now, when this happens, the body resorbs more water from the kidneys, which results in increased plasma and extracellular fluid volume. This eventually leads to raised cardiac output, which is the amount of blood pumped by the heart per minute. When this is raised, it eventually leads to raised blood pressure or hypertension. The environmental factors like air or noise pollution, cold temperatures, and high altitudes can also lead to functional vasoconstriction or defects in the smooth muscle growth and structure. This leads to increased vascular reactivity and increased vascular wall thickness. When this happens, the total peripheral resistance or the systemic vascular resistance is raised. When the resistance increases, the pressure of the blood inside the artery's lumen also increases. Now, when this pressure is increased, as we discussed before, this leads to hypertension. There's another system known as the renin, angiotensin, aldosterone system or the RAS system. This system basically regulates the blood pressure, but this occurs in the kidneys. And this system plays a very pivotal role in regulating the blood pressure. I will make a separate video on this soon. Most of the times a person knows when their blood pressure is raised. There are a few clinical features associated with it, for example, dizziness, headache, heart palpitations, nosebleeds, shortness of breath, anger, visual problems, fatigue, insomnia, but sometimes it acts as a silent killer and a person may not know how high their blood pressure is, and that is a very dangerous situation. A diagnosis of elevated blood pressure is based on the average of two or more blood pressure readings. Generally, we ask the patients to take blood pressure readings at home for 7 days. We discard the reading taken on the first day and take an average of the rest of the readings. The measurement should be taken on separate occasions in the same way. The first time the blood pressure is checked, it should be measured in both arms to determine if there's any difference, and the arm with the higher reading should be used. A longer blood pressure monitoring test can be done to check the blood pressure at regular times over 6 or 24 hours. This is done when the diagnosis is unclear. This is called as ambulatory blood pressure monitoring. We discussed about this when we were talking about the white coat hypertension. But if the practitioner knows that you already have hypertension, there are a few tests that need to be done like complete blood count, lipid profile, blood sugar test, kidney function and thyroid function tests, and ECG. This rules out if there's any secondary cause of hypertension. We discussed about these in the slides before. There are a few risk factors that contribute to the development of hypertension. For example, age, race. Afro-Caribbeans are more likely to develop it as compared to the Caucasians, and they do so at an earlier age. If you have a family history of hypertension, you are more likely to develop it. Being obese or overweight is a very strong risk factor. Lack of exercise, tobacco use, or smoking. Now, smoking plays a pivotal role in the development of hypertension. Very, very important. Too much salt or sodium in your diet urges the body to retain more fluid, and this in turn increases the blood pressure. Low potassium levels can also lead to raised blood pressure because potassium maintains the salt homeostasis in the body. Drinking too much alcohol, stress, and chronic conditions like kidney disease, diabetes, sleep apnea are some of the common conditions that can also lead to raised blood pressure. I will make a separate video on the relationship of diabetes and hypertension. Pregnancy also sometimes increases the blood pressure. Moving on to the management. If the patient is in the pre-hypertensive or stage 1 phase, we generally offer them lifestyle modification, which includes weight reduction, sodium cut down, DASH diet, reduced smoking and alcohol, and stress management. This itself is very important and it helps them control their blood pressure, and some patients might not need pharmacotherapy. But pharmacotherapy is needed for stage 2 patients where the blood pressure is equal to or more than 140/90. We generally start off with ACE inhibitors if the patient is less than 55 years of age. But if the patient is more than 55 years, or he or she is an Afro-Caribbean, we start them off with calcium channel blockers. ACE inhibitors prevent the conversion of angiotensin I to angiotensin II, and it prevents the vasoconstriction. Some examples are captopril and ramipril. Calcium channel blockers block the movement of extracellular calcium into the cell, causing vasodilation and decreased heart rate. Some examples are verapamil and amlodipine. Diuretics inhibit the sodium resorption in the distal convoluted tubule, ascending limb, and loop of Henle. Basically, they can either be loop diuretics, thiazide diuretics, or any kind of diuretics. For example, furosemide, chlorothiazide. Beta blockers reduce the workload of the heart to beat slowly and with less force. Some examples are propranolol and atenolol. Vasodilators like nitroglycerin or sodium nitroprusside can be given, and they act on the muscles of the artery, preventing them from narrowing. If you found this video helpful, please give it a thumbs up and consider subscribing for more content like this.